Hello, welcome to Buffalo Business Bits. I'm Stan Coleman. This is a video magazine where you get to meet the businesses that provide the services in our community. So let's jump right into it. Today's show has a medical theme. Our first stop is at the Brain and Spine Center in Williamsville. It's a brand new facility, but don't let the name put you off. It's a lot more than that.
Welcome to the Brain and Spine Center, Stan.
Thank you. Good morning.
Good morning. I'm very well, thank you. Let me show you around. One of the unique things we do at the Brain and Spine Center, Stan, is that we offer a little bit more than just the medical procedures. For example, here in this room, we have a silk peel procedure going on, which is a form of facial and collagen infusion and microdermabrasion. On the other side, we have some massage therapy going on. We do medical massage and therapeutic massage. When you've been in pain or you've had surgery, sometimes you just need to relax. So we do try to offer that to our patients, or to our clients, or to anybody who really needs that service. Here at the Brain and Spine Center, we also have a comprehensive physical medicine and rehabilitation department. We have our physical therapy department, we have chiropractic, we have the medical massage, which is different from the specialty spa massage, and we do physiatry, which is physical medicine and rehab. So we have specialty physicians and specialty doctors in physical therapy in all areas, as well as our chiropractors. Rheumatology services are another integral part of the Brain and Spine Center. Rheumatology is the specialty that takes care of people with rheumatoid arthritis or other autoimmune diseases. So we do a lot of things like injecting knees for people with arthritis so that they can live a normal life. We give specialty infusion services for people that maybe have lupus, Lyme disease, Sjogren's syndrome, or anything along those lines. And as I said, it seems a little out of the realm of brain and spine, but many people have multiple disease states that kind of interrelate and correlate. And so you might go from a neurologist to a rheumatologist to a physiatrist to a physical therapist, all in one place. As a neurosurgery and neurology center as well, we do a lot of teaching. Over here you see one of our Damon College physician assistant students being taught by one of our providers. Neuro and neurology and neurosurgery are brain-related, muscle-related, nerve-related, so they're very integral and they're very comprehensive. We do a lot of diagnostic studies here, neurodiagnostics primarily, including nerve conduction velocity studies, electromyography. Those types of things are done for carpal tunnel syndrome, ulnar compression syndrome, brachial plexopathies, and radiculopathies. We also do EEGs, bear testing, SSEPs. Those are a lot more definitive studies that are done for very exclusive types of conditions. Because the Brain and Spine Center involves so many people having neck surgery, back surgery, even wrist and ankle work in the physical therapy department, we provide the braces right here. You don't have to leave, take your prescription, go to another place, get fitted. The same people who prescribed it for you, the same people who care for you, and the same people who are billing for you can do it all here. One comprehensive, multidisciplinary approach to your care.
Our practice started out about 6 years ago with just neurosurgery, and we rapidly found out that the patients needed much more than just a surgeon's hand. And there was a large discrepancy in the quality of care when patients were referred out to other various entities that really didn't have information sharing with the Brain and Spine Center. By providing all of these services in one facility, we are able to provide comprehensive treatment. The unique aspect of this practice is that all our providers share the same medical record and communicate with each other. This practice allows the physical therapist to see exactly what the neurosurgeon is thinking, to see what your MRI shows, for the rheumatologist to see what the physiatrist is thinking, for the neurosurgeon to see the response to physical therapy or chiropractic treatment or massage therapy. Your massage therapist can see what your neurologist is recommending. The comprehensive record provides the best patient care.
Are you one of those people who wake up in the morning, you look in the mirror, and you don't like what you see? So you get yourself all gussied up and ready to go, and you look in the mirror again, and you still don't like what you see? Then maybe you need to take a trip to Advanced Aesthetic Medical Spa.
We at Advanced Aesthetics Medical Spa have the latest and newest technology in lasers. We are in the business of making you look and feel better. We have a variety of lasers here. We actually carry 3 lasers, and we can treat all skin types and all hair colors. We also have lasers that will do skin tightening, wrinkle reduction, And we have other treatment options that can be used in conjunction with those to give people the end results that they desire, to look better and feel better.
A sophisticated new technology known as electro-optical synergy, or ELOS, has been used to create an efficient and highly effective weapon in the war on unwanted hair. Thousands of women and men are enjoying smoother, silkier skin as a result. Here's how it works. A unique combination of radio frequency and light is generated to isolate the treatment area and leave the surrounding skin free from potentially harmful side effects. Using gentle pulses of 2 targeted energies means better results with lower overall energy, assuring the highest level of safety and comfort. Refirm Skin Tightening with Wrinkle Reduction is a revolutionary technology that can restore the look of youthful skin. Refirm helps tone and elevate common problem areas of the skin, such as redefining the jowls, filling the creases beneath your nose, or elevating the skin around your eyes. Here's how it works. Refirm features the revolutionary ELOS combination of bipolar radio frequency and light energies, which precisely heat the dermal tissue within the targeted area of treatment. This focused, deep heating produces a firming effect in your lax skin. Fine wrinkles are reduced, there is a noticeable lifting, and the texture of your skin becomes smoother, illuminated, and visibly more toned.
Clients come to Advanced Aesthetics Medical Spa generally because they have concern for their health or their appearance. And here at Advanced Aesthetics Medical Spa, we have a variety of treatment options to help people along that lines. We have laser therapies, we have endermology, lipomassage, whole body vibration, we have chemical peels, microdermabrasion, facials, and a medical skincare line. We do Botox and dermal fillers. I've been a nurse for 20 years, a registered nurse, and for 7 of those years I've been involved in skincare, and I can honestly say that I have a passion for it. I have a passion to help people look better and feel better.
I had acne on my face and some discoloration with a little bit of fine lines and wrinkles that I wanted to remove. So I came here and got TCA peel with Lori, and I love my skin now. It feels very smooth, and the surface of my skin is great. It feels great.
If it's a younger client and she has concerns for her skin because she has acne and she's afraid of scarring, I hear some fear in her voice, and I try to calm her by saying that there are treatment options out there now that will actually treat and cure acne, and that is the laser therapies. And then depending on if some of the clients are older, they have concerns for some age spots or some rosacea or some leg veins that they have. And I again can assure them that we have treatment options here that will actually cure those problems. As it stands, no one has the variety of treatment options that we offer here. No one has the variety of lasers that we have here. And I can guarantee you that no one has the amount of passion that we have here.
I was nervous a little bit. I didn't know how it was going to feel, but it was great. It didn't hurt. And coming to a place like this, I felt like I was going to be taken care of.
There's nothing like having a great smile. Sometimes it can make the difference in our day and in someone else's day. Unfortunately, when our teeth bother us, smiling is the last thing on our mind, and the prospect of going to the dentist adds to our frustration. At Quality Care Dentistry and Elite Dental, that frustration is melted away with their state-of-the-art techniques, including sedation dentistry. Visit one of their 3 locations in Niagara Falls, Kenmore, and Amherst, and let them put a smile on your face.
When we were younger, we used to run and jump, and if we got a knee injury, it wouldn't take long for our knees to bounce back. But now that we're a little older, it seems like the old knees can't take the punishment they used to, and they certainly don't bounce back like they used to. And before you know it, someone's talking to you about a knee replacement. That was the old days. At Joint Reconstruction Orthopedics, they've developed a technique that can have you come into the doctor's office, have your knee taken care of, and have you up and walking the same day.
About 5 years ago, I hurt my knee running. I tore a lot of cartilage, and then came to see Dr. Rheumatology, who did a meniscectomy. He removed a lot of cartilage that was destroyed by my accident. He trimmed out so much cartilage, about 60%, that I had some relief from pain at that point, but of course the rest of the cartilage started to wear and wear until I was eventually bone on bone, and I could feel the grinding I could feel it when I got in and out of a car, when I turned over in bed. If I were walking in one direction and changed directions, I would see stars.
I don't know how I heard it, but I did hear it. And I thought it was just a minor scrape, and I kept getting more pain. And my wife and I decided that we had to go to the doctor and find out what was the matter. And we came to Dr. Rheumatology, and he said first we have to have x-rays. And the first time I went, he thought it was minor, and it was going to be a minor operation with 2 needles, and he was going to clean it, and he was going to be all right. But after I came back in 2 months, he found out that it got more severe, and he took more x-rays, and he found out that my knee just completely shattered, and we had to have this operation.
We here at Joint Reconstruction Orthopedics are a subspecialty group of orthopedic surgeon and rehabilitation doctors that specialize in outpatient partial knee replacement surgery. The 3 of us have over 58 years of combined experience treating patients with painful knees. For a patient to have a partial knee replacement procedure would be to relieve their weight-bearing pain, the pain they feel with walking or stair climbing. Another problem that patients with this knee arthritis often have are instability in the knee that occurs with walking or stair climbing, and a partial knee replacement will help relieve that pain. Also, sometimes patients will present with a bowing of the limb, and a partial knee replacement can help straighten the bowed limb. Many patients that come to us have had other procedures, for example, an arthroscopic procedure on the joint that failed to provide them with lasting symptomatic relief. Oftentimes, for that patient, a partial knee replacement will be an effective way to reduce or eliminate their pain with walking. What sets us apart is that we actually subspecialize in the Rapisi 2 procedure, which is an outpatient partial knee replacement procedure. For many patients, it's an effective alternative to a total knee replacement that allows great relief of their weight-bearing pain, and it can be done on an outpatient basis. The main reason that patients choose to have their surgery performed here with us is that we're the leaders in the community in performing partial knee replacement surgery on an outpatient basis. And our senior partner, Dr. Rapisi, actually developed the technique.
After my surgery, I never had the kind of pain that I had before the surgery, even in my recovery, even immediately within the first few days. I never had the kind of pain that I had before the surgery. I was deliriously happy.
I was very happy with the outcome, and I think a couple weeks after that, we came back to Dr. Rheumatology. That's when I shook his hand, and I wanted to hug him, and I says, "Doc, you're a miracle worker." I says, "I don't care what anybody says, you're my Messiah, because when you completed this operation for me, I am a new man."
Losing the use of a limb is never our choice. But from that moment on, the most important thing is regaining as much mobility and comfort as is possible. Campanella Orthotics and Prosthetics is board certified and has 45 years experience in making people's lives better.
It was like I could walk again. It was almost as good as having my leg back.
Life may have dealt you a severe blow, but the choice of how you deal with it is in your hands. Call Campanella Orthotics and Prosthetics at 882-7938.
I was a fat, former English professor, forlorn, frumpy, absolutely miserable. I weighed 200 pounds, I wore a size 20, I had sagging flesh everywhere, and I heard about Dr. Jeffrey Micklellan in Williamsville, and my life was saved. Dr. Micklellan did a large volume liposuction procedure on me. I lost 27 pounds from that, and to be quite honest, after that I changed the way I looked at food, and it took me another year, but I lost another pound a week on my own. I've lost almost 75 pounds. My whole life is totally different. As I looked in the mirror though, I realized that my face didn't match my new body, so I got a facelift, and I'm really glad that I did it. All the potential I had before was buried under fat and sagging facial skin, and now it's gone, and I feel like I can go out there and have a new lease on life, literally. It was the best thing I've ever done. All of you that are afraid to go or feel like you're selfish, I don't want you to feel that way. Dr. Micklellan believes that anything that steals your self-esteem is something that should be corrected if it can be corrected. And for most of you, it can be corrected, and for me it was. It was the best choice I ever made in my life. I'm active in my career now. I just feel like the world is open to me, and there's so many things I can do and I want to do, and I'm not going to stop. And I encourage all of you, if you feel like you could make some changes in your life, or if you have stubborn flesh that will not go away, give Dr. Jeffrey Micklellan a call. It really is well worth it. It's the best thing I've ever done, and he's an incredible doctor. He is gifted medically and surgically. He's very conservative, careful. He's been a plastic surgeon for 25 years. You need someone that's very experienced, and you can't beat Dr. Jeffrey Micklellan, and he has a very good heart, which is very important to me.
Initially, our surgical procedures were mostly reconstructive, and over the years, it has evolved into a cosmetic type of practice. We've been out here in Williamsville now for probably 18 or 19 years, and about 95% of what I do is cosmetic surgery, the same kind of surgery that one sees and associates with the Beverly Hills shows on television. It is my personal philosophy that I want people medically treated properly. We're worried about their health. We're worried about how they look physically. I also am concerned about trying to do the best that I can in terms of giving back to, let's say, society and the world at large, the things that I've learned in terms of plastic surgery. So we may go abroad and do different types of procedures every year to help different children. But when I'm back here in Buffalo, most of my focus is on cosmetic procedures. And I want all our patients to get the best medical care possible, and I want them to be as happy with the kind of treatment as they get.
Now, Doctor, how much of a difference does this make emotionally to people who come in for change?
Most of the people who come in for cosmetic procedures get, I think, a dual advantage. I mean, they get to look better, but I do think that it helps them in their life in terms of how they deal with other people and how they deal with their own life. And I've seen that time and time again, and I'm very pleased to say that it's usually a positive change.
The diagnosis and treatment of conditions of the brain, spine, and musculoskeletal system are some of the most complex areas in medicine. At its new flagship headquarters in Williamsville, the Brain and Spine Center physicians use the most advanced technology, treatment, and therapy. But it offers much more than that. Through our specialty spa, chiropractic services, and physical therapy center, we make sure you feel your best inside and out. For peace of mind, call the Brain and Spine Center, 631-3555.
You deserve to be treated well. You deserve to be pampered. And who can treat you better than you treat yourself? The answer, Advanced Aesthetic Medical Spa. Through state-of-the-art laser therapy, Advanced Aesthetic Medical Spa can provide solutions for a variety of skin problems.
No one has the variety of treatment options that we offer here. No one has the variety of lasers that we have here.
To pamper yourself, call 568-2139.
In 1973, Andrew Mcclellan was in a terrible car accident that caused him to lose a leg and needing a prosthetic. Today, he is president of Environmental Education Associates, but he is also an expert on prosthetic legs.
Well, I've been through quite a few providers over the last 35 years or so. Pretty much everybody in Buffalo, in Western New York for that matter. And some experiences are good, some experiences were not so good. There's varying, different prosthetists have different skills, and not always a very pleasant experience.
Kimberly Kaminsky-Farrell was at work one day when she fell down a flight of stairs. She was sore but worked the rest of the day and could still walk. The next day, her leg went numb. She went to the doctor and was told it was a minor injury, and soon she was walking again. 2 weeks later, her leg went numb again, and she lost the ability to walk unassisted.
I went for 4 years using either crutches or the wheelchair, which you can't do much, especially when you have two small children, trying to grocery shop, trying to carry a baby around on crutches doesn't work very well. You can't do laundry very easily in a wheelchair. And when they got me the brace, I was like I could walk again. It was almost as good as having my leg back.
Lester Allen comes from a family that is prone to diabetes. In 1997, he was told his blood count was very high, but he didn't take the situation seriously. He weighed over 300 pounds and didn't eat properly. In 1998, he developed a foot infection that resulted in the loss of his toes. 2 weeks later, he lost his foot. Still not taking the situation seriously, Lester lost his leg in 1999. What these three people all have in common is they are clients of Campanella's Prosthetics and Orthotics. Each has been a patient for years, and each have glowing stories to tell of their treatment and the professionalism of this Buffalo company.
They have gotten me to the point where I feel like I'm not an amputee anymore, and that I can get along by showing people by walking how well I do with my prosthetic.
He's phenomenal. He is phenomenal. He will sit and listen to you. He's patient. He'll take his time. He'll make sure that you're 100% completely satisfied.
I highly recommend Campanella. For someone who's looking for an organization that has a level of professionalism, a technical expertise, an understanding of how the way things could be, Campanella is going to be the place to go to.
The Campanellas are very compassionate people. They travel around the world donating prosthetic supplies to third world countries. They work with other doctors who do humanitarian work to help children from poor nations who need prosthetic limbs. They may be small, but they are big on service and integrity.
Campanella Orthotics and Prosthetics wants you to know you have a choice, and it is the law. Some doctors or physical therapists might tell you where to go to a certain area or a certain prosthetist or orthotist. It is still the law, it is your choice. The reason why we want you to come to our facility is because we are American board certified, we're an accredited facility, and we have 45 years of experience.
We may not be the biggest company, but we certainly do the best work, and we form a lasting friendship with our patients who come to us over the years. Usually someone who needs a prosthesis or an orthosis comes to us often to have it repaired or to have a new one made, and we know them for a long, long time, and we establish a trust between them and us, and therefore we enjoy our work because of that.
You know, we were just talking about making yourself look good, and a big part of looking good is having a great smile. But it doesn't matter if you have a great smile and you look good. If your teeth hurt, you don't feel good. It's like having a headache that never goes away. If that's your problem, you need to visit the people at Niagara Quality Care Dentistry. The fact is, no one wants to go to the dentist. Even when we know we should, we will do almost anything and go through any length and most certainly put it off until we just can't wait anymore. Usually it takes dire circumstances to make us go. And that's just what happened to Jamie DePietri.
Well, about 10 years ago, I started getting severe pain in different teeth, and it was just awful. Excruciating pain. Sometimes I have to go to the hospital. I discovered my teeth weren't good. I had needed several root canals in the teeth, which resulted in crowns. Some of the crowns didn't work, which meant they kept falling out.
Jamie is a 38-year-old mother of two great kids. She is a daycare provider, so she has a lot more than that on a daily basis. If you think a house full of kids could make you pull your hair out, what would you think if all of a sudden your teeth began to fall out?
In all aspects, I didn't want to go out. I was afraid to have pain. I was afraid to have teeth fall out. I was afraid, to smile because all my teeth didn't look right. It was kind of miserable.
That's enough to give you a toothache. Taking the advice she was given about implants, she came to Niagara Quality Care Dentistry in Niagara Falls. They began working on her problem, and now she is all smiles.
I chose to get the implants, and I have to say it was the best thing I ever did. I'm confident, I'm happy now. I'm thrilled to have, a smile that I don't have to,
shun away from or be nervous to open my mouth or anything like that, and I'm confident now that the teeth in my mouth will stay in my mouth. This office is wonderful. It's been great. I would recommend implants and this dentist to anybody and everybody who has any kind of problems like I've had. I've been taken care of wonderfully. I can call anytime, get right in, and I don't have nothing but great things to say. Life is wonderful now. It's tremendous. I'm happy to smile. I'm happy to be around people. I'm not nervous. I don't get embarrassed anymore to smile, and I don't have the worry of my teeth falling out.
Finding a good dentist is like finding a good barber or good hairdresser. You want them to be able to do whatever you need, when you need it, and want them to do it well, the first time. That's the goal of Niagara Quality Care Dentistry.
In our practice here, we basically cover full scope of dentistry, and we not only care for patients with their regular dental needs. By that I mean their cleanings, their restorations as far as fillings, the crown and bridge needs, dentures and root canals. We'll also cover extending that to basically cover implants. We also offer sedations, which is a great tool for patients with a lot of anxiety. The associates of the practice, including Dr. Robert LaCaruba, we're all general dentists, but we all have postgraduate training. By that I mean after dental school, which is 4 years in duration, we all went to a training program, residency program, 1 or 2 years, depending on the program. And during that time, you get all sort of aspects of dentistry, from the simple to the most complex, including, like I said, sedation and implants as part of it. And everyone in the office is trained, and I know me personally, and Dr. Jared Condi is another associate here, both qualified to do IV sedation, intravenous sedation, which is the conscious sedation we're talking about. As far as implants, the same thing. But we don't have any specific, we don't have any specialists in the office, but we're all trained to provide that care to the patients.
All too often we take the simple things in life for granted. Just think of the everyday pleasures we would lose if we had constant and severe pain in our knees. Sometimes a knee replacement is necessary, but at Joint Reconstruction Orthopedics, they have developed a technique that, if you qualify, may restore your knee health without a complete replacement. Just think of it. Happiness restored by a procedure performed in the doctor's office. Find out if this is for you. Call Joint Reconstruction Orthopedics at 839-0632.
Forget about everything you've ever heard about plastic surgery. It's for anybody who wants to look prettier, a little sexier, a little younger. It's effective and affordable. Whatever your reasons, rely on someone with over 20 years experience in providing cosmetic and reconstructive surgery. Board-certified plastic surgeon Dr. Jeffrey Mileman. Regain a youthful look. Visit Buffalo Plastic Surgery, giving nature a helping hand. Call 626-5300 today.
That's our program for today. Thank you for watching. I'm Stan Coleman, and keep an eye out for Buffalo Business Bits.